Now we are going to visualize the clinical presentation of the complication. For the clinical presentation of complication, we have hypothermia. Hypothermia can just be measured with the temperature, is it clear? And the best temperature in this case, intrarectal temperature, is it clear? Now we have hypoglycemia. Hypoglycemia is just going to be inactive, is it clear? It's not going to have energy. He may have be confused, may be lethargic. So those are the signs of hypoglycemia. The next one, we have dehydration. We are going to have signs of dehydration, which are, we have the central nervous system. We are going to have that the child is going to be lethargic and be confused. We can have increased thirst, is it clear? You can have increased thirst. In the cases of the eye, you're going to have reduced tearing. You're going to have oral mucosa is going to be dry. Is at the level of the abdomen, you're going to have the skin turgor is going to be increased. Actually, the skin turgor is the time for which the abdomen, or the time for which the skin has to return to its normal morphology after it has been pinched. Is it clear? So the skin turgor, it is not the elasticity of the skin, but it's the time for which the skin has to return to its normal morphology after it has been pinched. So if you pinch the skin and you elevate it like that by holding with your finger, is it clear? You pinch the skin. The time for it to regain to the normal position is what is called the skin to go, and that's why that if that time is greater than 3 seconds, there's a problem. Other signs of dehydration, we have capillary refill time that's greater than 2 seconds. Is it clear? That's the time for which it has to refill the capillary bed of the nails after you have pressed the nails and it has been blanched. Is it clear? So those are the signs of dehydration that you are going to evaluate. Others, you have hypotension, other, but that's when dehydration is complicated to hypotension. You can have also postural hypotension, all that. The next element, you're going to have mineral deficiency. Basically, when you have mineral deficiency, for mineral deficiency, you need to know that what you're going to have signs of electrolyte imbalance. Is it clear? And signs of electrolyte imbalance can be potassium, can be sodium. If you have sodium ion, low level of sodium ion, you're going to have what? You're going to have a problem with fluids. Every time that you have a problem, low level of sodium and low level of potassium, you have a problem with fluids. So low level of sodium is going to be associated with low level of sodium is going to be associated with fluid overload. Is it clear? Well, but high level of sodium is going to be associated with hypertension, and it's also be associated with low loss of fluid. Is it clear? So those are the different elements that you have to understand. Potassium is mostly going to affect the heart and also affect the brain. So you're going to have convulsion, and you have also arrhythmias at the level of the heart. Is it clear? Calcium is mostly associated with the bones. Is it clear? So if you have calcium abnormality, a hypercalcium is going to present with a particular symptom of bone, groan, and moan. Is it clear? So those are the different things that you have to know. Then we have iron. Iron is also going to be associated. So low level of iron is going to result to anemia. We have vitamin deficiency, and we have seen all the vitamins in the tutorial of the mechanism and the pathophysiology. The next one, you're going to have the infections. We have infections also that is going to occur because of particularly some peculiar vitamins that are used in infection. And infection is going to be shown by what? It's going to be shown by signs of fever, and we have signs of focalization of the infection. Is it clear? So you have fever, which shows the systemic spread of the infection. We're going to have also lymphadenopathy, which shows the regional spread of the infection. And then we have the local spread of the infection, which is shown by the point of focus, where if the point of focus is the lungs, you're going to have pneumonia with consolidation syndrome. If the point of focus is the urinary tract, you have irritative urinary symptom. If the point of focus is the GI tract, you're going to have irritative gastrointestinal symptoms like vomiting, diarrhea, abdominal pain, and all that. So the other one is low energy, low protein, apathic. This one can only be seen based on the activity and the phase with the mood of the child. Is it clear? So those are the different clinical presentation of the complication. Now we are going to move to how to make a diagnosis of malnutrition.